Hello, this is Fight Back, a podcast by the Healthcare Consumer Rights Foundation. I'm Steve Poizner, founder and executive director. Our nonprofit's mission is to help you navigate the complex healthcare system and understand your legal rights, options, and opportunities when you encounter problems and obstacles. We want to empower you with the information you need to fight back and get the best possible care. What would you say if I told you that doctors could eliminate the need to prescribe narcotics in almost all circumstances, even after spinal surgery? It may sound far-fetched, but that's exactly what we're going to discuss in this installment of Fight Back when we dive into the topic of holistic medicine. We will see how this looks in a day-to-day practice. Our conversation today will address everything from incorporating probiotics to taking into account the food you eat. How your gut health, that's right, your gut health plays a huge role in your overall health, and how the balance of good and bad bacteria in your gut can impact how you feel. How preventative nutrition can help you before a medical procedure and help you in recovery post-op, and much more. I will be joined by special guest and orthopedic spine surgeon, Dr. Hooman Melamed, to discuss these issues. Dr. Melamed is an advocate of holistic and integrated medicine. The idea we need to address all aspects of our health for our bodies to be in optimal condition. He will share with us his personal experience with transforming his diet to deal with health concerns and how you can do it too. Listen in to learn how you might benefit from a more holistic and integrated approach to your health and set you and your family on a path to a long, healthy life. Let's get started. Dr. Melamed, welcome to the podcast.
Thank you very much. It's a pleasure to be here.
Well, thanks. Dr. Melamed, you are a national leader in integrating holistic and integrated medicine into your medical practice. For the folks who are listening to the podcast today who are not medical professionals, what do those terms exactly mean, holistic and integrated medicine?
Very, very good question. To me, we have what I call Western medicine, which is what typically is taught in most medical schools, which is what I learned as well, that you have to learn different diseases, such as you have blood pressure, you have cholesterol, you have diabetes, you have autoimmune disease, you have rheumatoid arthritis, you have this disease. Oh, no problem. We had to memorize all this pharmacology and all these drugs. Sure, for everything there is a drug. But then as evolved, when I to my practice, I started thinking that we have to do better. Like, why is it we're developing all these diseases? And then many years ago, I met somebody who basically opened my eyes into this whole world of holistic and functional integrative medicine, which means that these diseases, all the root causes is because of your gut health and your food. So you use food as medicine and you heal your gut basically. So if you use food as your medicine and you heal your gut, you don't need a lot of these medications. And I felt that the big pharma was influencing a lot of the medical education. And in my medical school, honestly, I don't even recall there was a class on nutrition. Now, the good news is that some medical schools, not all, a small percentage are teaching nutrition and the value of integrative medicine to medical students, but that's not enough. That needs to be the curriculum for all medical school, basically. And they used to say, well, you get cholesterol because you just old age, genetics, diabetes, that's old age. That's not true at all. I found out a lot of these are because of your diet and your food and your lifestyle. It's what brings on these diseases. And then I also looked, we are the number one in the world in terms of chronic diseases such as, again, diabetes, cholesterol, obesity, high blood pressure, rheumatological diseases, basically autoimmune disorders. We are the number one. And the correlation is very easy. Our diet is the worst. We have the worst diet. So I was getting some of it. I was also developing myself some high blood pressure, not blood pressure. I was getting acid reflux. I was pre-diabetic. I found out, despite being in good shape. And by the way, being in good shape has nothing to do with this. It all has to do with what I call silent inflammation, which a lot of people have. So when I learned about it, I treated myself where all my doctor friends were like, dude, it's impossible. You're going to need medications to treat all of this. And by food alone, I was able to treat everything. And I've never felt better, actually. So that's basically what functional, integrative, holistic is, meaning you use natural remedies to treat your condition rather than depending on pills, which have so many long-term bad side effects.
Right. Very interesting. Now, you're a board certified orthopedic spine surgeon. So to what extent do you try to treat people's spine conditions with these integrated approaches? Or is this also a strategy post-surgery to help with recovery, or both?
Both. I mean, the most important thing when patients see me, and if any of my patients would be listening to this, I think most can tell that I have a discussion about lifestyle and nutrition with them. And this is something I've started really doing in the last 2 to 3 years, especially the last couple of years for sure. That nutrition has become a massive part of my undertaking with the patients. And what I always tell all the patients is that, it doesn't matter who you see or what surgery you do. These are all quick fixes. It doesn't fix the reason why you are here seeing me in the first place. Of course, look, if you're in a major car accident or you have a bad fall, something happens, you injure your spine, sure. I'm not talking about that. I'm talking about whereas most patients are like, I don't know what happened. I just woke up, I started having back pain or neck pain, and then I started having some shooting pain down my arm or leg, for the past few months. I tell them, look, to treat this, we got to look at your lifestyle. You have to treat your lifestyle, because everything we do for you, even if you get better, we're not fixing the reason why this happened. If you don't fix the reason why this happened, guess what? It's going to keep happening, and it's going to happen to your other joints too, to your hip, your knee, your shoulder. You're going to have other problems as well too. So we need to get to the fixes, and nutrition is a big part of it, because I feel foods that cause inflammation, and some of my older patients who have arthritis, just by eliminating what I call pro-inflammatory foods, food that cause inflammation, has drastically reduced their arthritic pain. So once I try to teach the patients about their lifestyle, in addition to their ergonomics at work, of course, this is a podcast about nutrition, functional medicine, so I won't get too much into ergonomics and things, but also post-op, unbelievable recovery for the patients. I don't even give patients narcotics anymore. Since March of 2018, I think I've given narcotics to maybe less than 5 patients, and that includes few hundred of surgeries in the last 2.5 years that I've done, close to maybe 800 plus surgeries without narcotics now. And I'm talking like some big surgeries, small surgery, doesn't matter, any spine surgery without narcotics, because I feel integrating natural remedies and eliminating pro-inflammatory foods, you give your body the ability to heal itself like there is no tomorrow. And then implementing, as I said, like, turmeric, fish oil, good brands, make sure your vitamin D's, optimize your vitamin C, all these things you give the body, and it's unbelievable how fast the patients heal, and they don't have that much pain.
Well, aren't the implications really huge? I mean, don't a lot of people get hooked on narcotics, on opioids, because they have back problems or they're recovering from surgery? It isn't how so once they get started down that path, then they get hooked. So are you saying that the national opioid crisis, part of the way to fight back against that huge problem is to don't let people start the opioid or the narcotic in the first place?
That's absolutely very, very true. Yes, they have shown that, I believe, after 3 days of narcotic use, 1 out of 5 people have the potential to become addicted. 1 out of 5. That's scary. 20% after 3 to 5 days use of narcotics can become addicted. That's a very, very scary. And unfortunately, the problem is, me, just like a lot of my other colleagues, well, how did I learn about narcotics? Well, you go through training, the residency. So there was a protocol after, I was in orthopedic surgery. So after the surgery, patients were given some kind of narcotic, and depending which service you were on, different attendings, they had different favorites. So that's what they use for pain. And this is what I did when I came out. Never thought about it twice. And my point is that in order to fix this narcotic issue, we have to go all the way back to start at education from medical school and residency, because that's how you pick up your habits. And most doctors are creatures of habits. They don't like to change. For me, I started really thinking about it. Other parts of the world, they don't give narcotics for a lot of surgeries. And, there are other colleagues of mine who are pushing narcotic free, such as, doing carpal tunnel surgery that they're doing. Now there's studies are showing you can do carpal tunnel. And I said, what, why don't we just push it to spine surgery? And so I started doing it basically March of 2018. And yes, a lot of doctors, don't hesitate twice. I've had patients, they go to the ER with back pain, they get a prescription for Percocet for 50 tabs, or they even have an ankle sprain. I've seen patients with a ankle sprain go to the ER, they get like Vicodin prescription. It has become, unfortunately, it's been given out like candy among many practitioners. And I feel there's a huge lack of education that needs to be implemented in order for us to really severely curtail this opioid crisis.
So education, not only for medical professionals, but consumers here too need to be educated, right? The title of our podcast series is Fight Back. We're trying to empower consumers with information. What's your advice then for listeners when they go to their doctor and the doctor, wants to prescribe some type of narcotic? I'm assuming you're suggesting consumers should question their medical professionals for other options.
Absolutely. I've had lately, thank God, I think because of this whole opiate narcotic crisis that's been going on, I think has opened some people's eyes, because I've had patients who were referred to me and their regular doctor or whoever they saw before they came to me gave him like a prescription for like 50 tabs. And the patient told me, oh, I never took it. I was like, no way, I'm not taking this. It's like, I just threw the prescription out the window. I'm like, I'm not taking this. There's no way, because I was afraid I'm going to get hooked on it. So thank God some patients are educated and they do know how bad this could turn out. My advice to everybody who's listening is do not take narcotics. Honestly, narcotics should be for, God forbid, you have some untreatable cancer, on God forbid you don't have a few days left and you just want to be in a total body relaxation. You want to go out peacefully. Maybe narcotic is good for that. But for many orthopedic conditions or many extremities, your spine or anything else, I would say 99% of conditions, you do not need narcotics. Absolutely, you should fight back. And I like that word, fight back with whoever your doctor is, whether you're in the ER or your internist or whoever, your specialist, tell them, no, I'm not going to take this. You need to give me something else. Think about other remedies. Let's think about outside the box. Do other things. As I said, using food as medicine, avoiding pro-inflammatory foods, foods, fish oil, turmeric, ginger. There are also other over-the-counter holistic stuff that they can take. So all of these things, yes, fight back, don't take the narcotics. Absolutely, question that.
Right. So let's go back to something you mentioned a moment ago. You said that a lot of patients come in to your office with back pain, neck pain, shoulder pain. Is it possible to reverse those conditions without surgery? Or is it the case that once they're at the point of having some pain, is some surgery needed to fix whatever the problem is, and then it's about making sure it doesn't happen in the future? Or is some of this reversible?
Well, the very good news is that, Steve, that most spine conditions, the vast majority, I would say about 90% of them, can be absolutely treated without surgery successfully. Like I'm talking about you getting back to your baseline function as though nothing ever happened. And it requires, some work on the patient's part. You got to, dig in with conservative modalities such as with physical therapy, of course, really lifestyle changes too. If you implement lifestyle changes, if you're still in bad habits that brought you to my office, I mean, the chances of you getting better, it's not going to be that great, because if you're continuing the same path that caused the injury, you're not going to get better. So it's about reversing, educating, and I tell you, most patients, of course, want to get better without surgery. So people do make changes. The only thing is that some people make the changes when they get better, then they go back to their old habits again, which is not good. Then they land right back in again. But most patients are really implementing these changes, and 90% of them, I can say, I've been able to help 90% of the patients avoid surgery.
Yeah, Dr. Melamed, could you provide a little bit more information about what exactly is an anti-inflammatory diet?
Yes. So you have to look at the evolution. I would like to say our evolution, where the humans came from. If you think about where we came from, and if you look at the agriculture revolution was not till about 10,000 years ago. We humans have been around for millions of years. So the agriculture revolution was 10,000 years ago. Why is that important? Because 10,000 years is not enough for us to evolve in an evolutionary way. What does that mean? So agriculture revolution brought to us a lot of wheat, the bread, basically, grains, a lot of grain. That's really when the grain came from, right? The grain, barley, rye, oats.
Right.
So our digestive system, 10,000 years is not enough for it to adapt to basically these chemicals or these compounds, such as barley, rye, oats, and grains. I know a lot of people have bread and whole wheat bread, but really, grain, barley, rye, oats are very inflammatory for you. I know maybe some doctors listening, they think there's no way, but that's really the truth. You can talk to some of the patients who have autoimmune disease. Them eliminating these food from their diet, they have felt immensely much better, basically. Now, I'm not telling you don't even have bread. Sure, you want to have a piece of a toast once in a while? Sure, go for it. I'm talking about repeated consumption of these on a daily basis will cause, disrupt your gut health, and would cause what we call leaky gut. So that's what the inflammation is. Inflammation is that your gut microbiome, your gut structural integrity gets destroyed from within, and bad stuff starts getting in that should not get in. And bad bacteria starts populating your gut and eliminating the good bacteria. So again, grain, barley, rye, oats. Now, if we were in Europe right now, if you were in a French bakery or Italian or Switzerland, their bread is very different than us. It's only on white flour only, no preservatives. And you want to have a little bit of that maybe every day? Sure, no problem. I do have a problem with our bread here because it's full of like wheat and so many other preservatives. Like a bread in Europe would only last a day. A bread in the US, most breads, you put them in the refrigerator, they're still there 3 weeks later, So those are the things, the inflammatory. So nightshades are also another one, believe it or not. It's the seeds in the nightshades that are the problems. Again, I know many patients who've said when they eliminated the nightshade, they felt so much better. The seeds in a tomato, cucumber, eggplants, zucchini, they're the problem. So myself, my wife, and I, we tend to get rid of all of the seeds when we consume nightshades. And I have noticed the difference, basically. Like tomatoes used to make me very bloated. Now, if I take the seeds, I don't get bloated anymore if I have tomatoes, basically. So nightshades, we said grains, barley, rye, oats, dairy. Dairy is another huge inflammatory marker, especially the dairy in the United States. If you want to do almond milk, pure almond milk, no preservatives and unsweetened, go for it. Coconut milk, unsweetened, go for it. But I do have a problem with most of the dairy in the United States. Now, if you want to consume dairy, for example, butter from Ireland, no problem. If you want to consume some of the cheeses that are from France, Italy, Switzerland, no problem. Why? Because that dairy is very different than our dairy here. For example, my family and I went to Europe last year, and when we got there with my mom, all of a sudden I see her the first day we were about to have breakfast, and she pulls this pill out of her purse, and she's like taking this pill. I'm like, Mom, what are you taking? She's like, oh, it's for my lactose. I have lactose intolerance. I need to take it because she wanted to have, some dairy in the breakfast. I said, Mom, you don't have lactose intolerance. It's the dairy in the US that's the problem. I said, I bet you if you eat the dairy here, nothing is going to happen to you. And guess what? My mom consumed the dairy without the pill. Nothing happened to her. In fact, most of my patients tell me that when they're in Europe, they don't break out. They don't have stomach problems because that dairy over there and that the white flour bread only does not have all the inflammatory that we have here. Another one also inflammatory is meat, animal protein. If you consume what I call 100% grass-fed beef, pasture-raised chicken, not organic or free range, but pasture-raised chicken, also pasture-raised eggs, not organic or cage-free eggs, but pasture-raised eggs, and only wild-caught fish, not farm-raised. Very, very critical. At all costs, avoid farm-raised fish or seafood. Wild-caught, these don't have the inflammatory markers in them. But if you take farm-raised fish, which most of the fish and sushis have it, if you have regular chicken, regular beef, they're full of antibiotic hormones, and worse, they're fed their unnatural diet, which is grain and soy, which are very, very bad for you. So this is how you can, as you can see, there's so much around people that they're consuming a lot of inflammatory food.
Right. So when you've had to fight the negative effects of the wrong kinds of foods and an inflammatory diet, once you switch to an anti-inflammatory diet, how long does it take your body to recover?
So this is very, very important. A lot of people are like, God, doc, so that means I can have my pastry, I can have my, like your cheat meal, whatever. I want to have my French toast and stuff like that. I say, no, of course you can have all that stuff. But here's a very important thing. It's like if you get a cut on your arm, if you get a deep gash on your arm, that deep gash, it's not going to heal overnight. It's not going to heal in 2 days. It's not going to heal in even a week, So you have to allow your gut to 100% heal itself. Then you can start introducing your cheat meals, basically, if you want. Like you want to have your French toast once a week, it's fine. That process, it's minimum 3 months. You got to be hardcore, like very, very hardcore for 3 months. Once your gut heals, because the problem is that if you're not hardcore for 3 months, every time you cheat, you're not allowing that gut to heal, basically. You keep opening up that scab again, and you cause that damage to continue. Once your gut heals, sure, you want to have French toast once a week, which is sometimes what I do. You want to have your pancake. You want to have your big chocolate cheesecake, slice of it once a week. Sure, go for it. But then I'm not talking about like cheating. Oh, a lot of people say, well, I only cheat at nighttime only. Well, no, that's not good. You're cheating every day. That's not good. I'm talking maximum cheating once or twice a week maximum. That's it. 2 meals. You want to cheat? Fine. You want to have a little bit? Go for it. But once you really go on this anti-inflammatory, you will see that you can't eat the way you used to eat because you develop such a afterwards reaction, such a stomach pain, and you're like, God, I can't believe I was eating this. So your body actually starts developing an aversion to some of the food that you really used to like, because you become so healthy and you don't miss it anymore.
Interesting. Now you mentioned, flour and wheat and rye and so forth. How does this relate to a gluten-free diet?
So a lot of people say gluten-free diet, and in fact, it's funny. My wife is talking about this. I'm going to be gluten-free because she's pregnant right now, and in her pregnancy, she like she has bread, she gets very sick. She's gluten-free, and I tell her, look, you got to be very, very careful. The problem with gluten-free is that sometimes they substitute other material that are just as bad as the gluten. I tell all the patients, try to go lectin free, lectin, lectin free. Lectin free is eliminating bad proteins, including gluten. Okay, so gluten belongs to a family of proteins called lectins. And another one of the proteins, I can't, honestly, it's such a long name. I can't remember off the top of my head, but it's part of the wheat. It's like W something, which is just as bad as gluten. And sometimes that gets substituted instead of the gluten. So be very careful with the gluten free. Make sure other bad things are not substituted. So because I've seen sometimes they put like soy in there, they put like corn in there, that stuff is not good for you. That stuff is all genetically modified. So be careful with that. I say if you go lectin free, you're automatically gluten free, and you've eliminated all the bad stuff, basically.
I see. Well, let's talk a little bit more about your gut. You've mentioned it a few times. The gut is an amazing part of the human body, super complicated, right?
Yes.
Can you talk a little bit about what the gut does for the body and how it impacts your overall health?
That's very critical. In fact, most people don't think about it. They call gut the second brain, basically. We have more nerve connections. So think about it. More nerve connections. I'm going to repeat again. More nerve connections from the gut to the brain than anywhere else in the body. I mean, think about it. When you run, how much motor nerve connections are going from your legs to your brain to make it happen for you to be sprinting? I mean, you would think that's the most nerve connections to your arms and legs because you're using them all the time, but that's not the reality. Or your eyes. The reality is that there's more nerve connections from your gut to the brain. In fact, they're showing now that people who develop Alzheimer's, Parkinson's, even ALS, multiple sclerosis, all these things are apparently coming from the gut, basically. A poor gut health over decades leads to these conditions. And also, again, we are the highest in the world in Alzheimer's, Parkinson's, neurodegenerative disorders in the world. And that goes against our diet. So gut is very important. In fact, I tell my patients, after the surgery, my focus is to focus on your gut health. I want to focus on your gut health because the faster we get your gut health back after the surgery, the faster you will recover. So a lot of conditions, diabetes, I feel a lot of chronic diseases, they all start from the gut. The gut regulates pretty much everything in your body. 70% of your immune system lines up your gut. So if you have a bad gut health, guess what? That is causing compromise 70% of your immune system. And gut health is what I tell my patients to focus because of COVID. Now we're in this current COVID crisis, the coronavirus, and you optimize your gut health, you're optimizing your immune system, and that's your best chance of fighting against COVID.
Right. A lot of people hear about the term probiotics. What is probiotics exactly, and do you recommend those for your patients?
Yes, excuse me, the probiotics. So there's another term called prebiotics, okay? I think it's important to distinguish prebiotics and probiotics. Prebiotics are things such as fiber, like something that is a high fiber content, such as a green unripe banana, green mango, green papaya that are not ripe at all, like inulin, high fiber. Those are what the good bacteria need to flourish, to multiply, to improve your gut health. Now, having said that, the probiotics are meant to have the good bacteria basically take over your gut health and eliminate bad bacteria and fungus. For example, using myself as example, I was having very bad gut health and I didn't even know it's happening. That's the thing. Most people don't know they have gut health. And that's how I learned about it. Is I was having, I had a hernia operation, and then I had developed, a couple months later, prostatitis. I'm like, how would I get prostatitis? And so I went to all these doctors. They kept putting me on antibiotic after antibiotic. I wasn't getting better until I learned from a colleague about gut health. And she said to me, look, I bet you have a fungal infection. I was like, fungus? What are you talking about? So we did a whole gut check on me. We did a stool test, and lo and behold, I had 3 funguses growing in my gut, which you're not supposed to have any fungus. And I had massive ratio of bad bacteria versus good bacteria. So quickly, she said, let's treat your gut. And God unholy and almighty, treating my gut got rid of my prostatitis. We didn't even treat my prostatitis. We just treated my gut. So we started with some antifungal. We gave some probiotic. She prescribed some specific probiotics for me. And of course, changing my diet was the most important. Once I treated my gut health, guess what? My prostatitis went away. And then I've repeated my stool test since then. I don't have fungus, and I have improved my gut ratio of good bacteria like massively. There's been such a huge turnaround in overall my gut health. So the probiotics, yes, I do recommend, people to consider taking them, but that is not a substitute. Again, that is not a substitute for a healthy, good diet lifestyle. The probiotic, I think they are good to get your body jump started in improving your gut health. But once you improve your gut health, basically, you cannot, you don't need the probiotics anymore. I don't think you need it. I think certain occasions, especially if you have surgery, because your gut gets depleted with the anesthesia medications, if you've been injured, sure, some probiotics can be very helpful. There is a lot of research, however, that is coming out showing that maybe certain probiotics for certain patients can treat certain conditions. I would reserve to give more information because the research is still evolving, but they're starting to show some promises that some of these probiotics can prevent long-term conditions such as Parkinson's, Alzheimer's, and even arthritis, actually. So I would like to reserve because this research is still evolving, but I think we're going to get there.
Right. If you go to Whole Foods, there's just a whole long row of different kinds of probiotics and prebiotics too, as you mentioned a moment ago. How should the consumer, how should one of our listeners go about researching, which one might be the right one for them?
Very good question. So I was also, same thing happened to me. When I went, I was like, oh my God, how do you know what to get? How do you know what to buy? There's so many different brands that are on there. I mean, to be honest, personally, I actually started looking into this and did my own research. And I actually developed a brand of probiotics myself, putting together 3 strains of bacteria that I felt are the most beneficial and the most critical for the gut. So I came up with my own formula. Now, am I going to say that my formula is better than the other ones? No, I'm not going to but I think my formula is pretty good because I've had other patients taking it and they're regular, clients, and they regularly order it because they feel it's made a huge difference. There's a difference for them. I would say, honestly, the best is to check with your functional integrative doctor. Check with your doctor and ask him about it. Because as I said, the key thing is the diet is the most important thing. If you have a specific condition, sure, you may need to supplement with the probiotics basically to get better, to get over that condition, to help you get better. And as I said, I think in the future, this is going to be regulated a little bit more, and there would be specific probiotics for specific conditions. I do really think that the future will be coming for that.
Right. Just a couple more questions before we wrap up here. We have listeners all over the country. How do you recommend, individuals, find doctors who are proficient, with holistic and integrated medicine?
That's a tough one because unfortunately, in every field, you have good teacher, bad teacher, good cop, bad cop, good dentist, bad dentist, good doctor, bad doctor, good accountant, bad, good lawyer, bad, all that. The issue is there are unfortunately some doctors out there who I feel take advantage of a patient's desperate situation and they charge a patient arm and a leg, and they give him all this false hope, and they basically sell him all these supplements, and it doesn't accomplish nothing at all. The patient is no better off, and there's so much money out of pocket. So just like anything else, do your research. Don't just go to somebody that says they're functional doctor. Read, go online. Thank God online, people can read stuff. See if you can get references. Get references from the doctor. I think if a doctor doesn't have any references, I think that should be a red flag sign. You should be at least get 4 or 5 references and talk to these patients and see what their experience was and how the doctor was able to help them. Some patients, a lot of my patients tell me, call me, and before surgery, they want to talk to other patients who've had surgery. I'm like, sure, no problem. Talk to whoever you want. And also getting a second or third opinion. If somebody says the treatment, I think you should think about it. And if you feel uncomfortable, get a second and third opinion and to see what somebody else will say. And, I wish I had something to tell you to avoid somebody out there who could be potentially acting as a charlatan or a shyster, but I don't. All I can say is that just do your due diligence, do your research, and hopefully you will ultimately find the right doctor, basically. And don't be afraid to ask questions. If something doesn't make sense, ask questions. And a health practitioner should be able to answer your question satisfactorily, logically, to the way that is good for you. If they're short with you and they don't want to answer your questions, that is a red flag. If somebody doesn't have the patience to talk to you, that's a red flag. My functional doctor that I had, they would sit down and talk to me, whatever, for an hour if I needed to, no rush, nothing like that.
That seems like a critical point here. Historically, I think a lot of people, were afraid to ask questions or to push back on doctors. The whole medical profession was kind of on a pedestal kind of thing. And of course, the medical profession is highly respected still. But I think you're encouraging people, not all doctors are the same, not all medical treatments are the same, and that people need to take responsibility really for their own health, right? They have to do their own research. They got to do their own due diligence. It sounds like that's super important.
No question about it. Look, the notion that do whatever the doctor says, don't ask any questions, that was maybe, I don't know, decades ago. That's not really true anymore. And I think, unfortunately, I wish I could sit down and tell you that all doctors are doing a fantastic, phenomenal job. Everybody's excellent and everybody's going to do the best thing for you. That's not true, unfortunately. And you as a patient have a lot of rights. And I always tell, ask questions. I think beware of doctors that you go in their waiting room, there are patients crawling from everywhere. They're so booked and you just get in there for 10 minutes in and out. I think that is concerning, especially, for the functional medicine integrative. To be honest, these doctors, the good ones, only see maybe 5 or 6 people in a full day. Because I remember my first functional medicine appointment was 2.5 hours. In fact, I got tired. I told the doctor, I said, okay, I think I had too much today. Let's recap, come back. But because she was so thorough. And, my subsequent other function doctor, he's very thorough too. He sits down, answers all my questions in detail. I can ask as many questions and he will sit down, explain, go through a very detailed explanation. That is very important. You don't want to go in there and somebody says, okay, here's a bunch of pills, buy them from me, and I'll see you next month. And all of a sudden, it's a price tag of $2,000 on it or something crazy. And then I'll see you next month. No, if they're not sitting down, explaining things very carefully that makes sense to you, be careful with that.
Right. And my last question, you mentioned, just a lot of information out there. I assume you recommend to our listeners, go to Google or to some search engine and you can type in gut health or anti-inflammatory diet, that kind of thing. I assume there's just a lot of information that people that are interested in these topics, a lot of places to go to learn more.
Yes, but you also have to be careful because I think there's a lot of other what I call marketing, advertising things that are out there that scientifically may not be true, and people may look at it and think, oh, okay, this is a good anti-inflammatory, I'm going to do it, which in reality may not be. So I would say don't just read something and just, oh, okay, I'm going to do it. Like, read it very carefully, look around, verify it, verify, validate it, make sure it is what they're saying. Make sure it's not, a friend of mine once told me, make sure, for example, it's not being supported by big pharma or something like that, by some other fast food company behind it. So those are very, very important things, So just make sure it's a real deal, that there is no ulterior motives behind whatever you're reading online.
Yeah, like buyer beware kind of thing. Super good advice. Dr. Melamed, thank you so much for being on the podcast today.
I very much appreciate it. It was an honor and a pleasure to be here. Thank you for having me.
I want to thank you for listening to today's Fight Back podcast. Our mission is to be a resource and to provide you healthcare information in a refreshing and interesting format. I also want to thank Hooman for all of his great information and insights into what an integrated approach to your health means for you and your loved ones. For more information, go to our website, www.healthcareconsumerrights.org. While on our website, you can check out additional podcasts or access more information and resources to help you navigate this healthcare system and get the care you deserve. We also welcome your input and stories that we can use on future podcasts. This is Steve Poizner, and this is Fight Back, a podcast by the Healthcare Consumer Rights Foundation. Thanks for listening. I look forward to our next podcast. Talk with you soon.